Hi guys, so I'm here on the second day of Lupus Awareness Month to kind of elaborate on my last video about what is lupus. Because I had a couple of questions afterwards that I realized I hadn't addressed in my video on what is lupus. So in that video, I kind of gave you like the overview of what it is and what it can do, but I did not go into like some of the symptoms that people can have when they start to develop lupus. And also I didn't talk about the criteria that needs to be met to get a lupus diagnosis. So the first thing I'm going to just go through are the symptoms that you can get. Now, these are like the common symptoms, but there are way more symptoms that people can get, and that's because of the fact that lupus can attack anywhere in the body. So there's so many different things, and quite often lupus comes along, it brings along with it other diseases as well. So for example, I not only have lupus, but I also have hypothyroidism, and I also have extra heartbeats. It's an irregular heartbeat, although they've never been able to link that as to being caused by lupus. Same with my thyroid condition. They haven't linked that to lupus, but it just seems to be common that people with lupus have other illnesses as well. So I have those two things that I'm on medication for the rest of my life as well. So the common symptoms are usually joint pain, almost like arthritic pain. You can get joint pain. You can also get swelling in the joints. An unexplained fever. So thankfully, I've never had an issue with fevers, but I know that a lot of lupus patients, they get a lot of fevers. Even if they're not even if they don't have a flu or whatever, they'll just get fevers. I've never personally had to have that. So there's the achy joints, unexplained fever, swollen joints, prolonged or extreme fatigue. And I think I kind of mentioned that in my last video. And you guys know, like, I've been dealing with the fatigue pretty much every day, but especially in the last week has been really bad because I have this, cold on top of it. Which, by the way, I think this cold is almost gone. I haven't been coughing. I haven't been getting that tickle in my throat. My voice is still a little bit raspy, and I still have a little bit of, mucus. But other than that, I think, I'm on the mend. But I'll see what the blood work results are today after work. Skin rashes, ankle swelling, and fluid accumulation, which is one of the things that I had really bad before I was diagnosed with lupus. I had a lot. My feet were so puffy and swollen, as were my legs. I mean, I just swelled up everywhere. Chest pain when breathing deeply, which is pleurisy. Butterfly-shaped rash across the cheeks and the nose. And so they call that the butterfly rash, and it is a very common symptom of lupus. I don't get the normal butterfly rash. I don't get the typical butterfly rash. Mine tends to just be that my cheeks will get really red and hot to the touch, but I don't get like a raised rash or anything like that. And I don't even know if my nose is actually affected, but it's usually my cheeks get very flushed and very red, and it tends to happen most of the time towards the end of the day when I'm really tired. And that is why the symbol for lupus is a butterfly, because most people have the butterfly rash. So that is how our symbol is a butterfly. You can also experience hair loss. I know I haven't experienced hair loss to the point that some people do, where they actually, like, some people can actually lose all their hair and go bald, or some people will get bald patches. I haven't really experienced that, but I do know that my hair has thinned out a lot over the years. And also the drug that I'm on, methotrexate, can cause hair loss because it is a cancer drug, but I'm on a very low dose of it, so I haven't had like my hair falling out like crazy. But I do find that I shed a lot of hair when I shower. I have like clumps and then when I brush my hair after my shower and blow dry my hair, like there is hair everywhere, and I'm always finding like hairs on my shirt and on my, I mean, it's annoying. It's really annoying. But thankfully it hasn't been to the point that I've been having like bald spots or anything, but I can definitely feel that my hair has thinned out, especially since I was a kid. Like my hair was super, super thick when I was a kid. So and then the other thing is sensitivity to the sun. And I burn easily in the sun, but I don't have a sensitivity in that I get rashes from the sun, thank goodness. I know that could happen at some point, so I do have to be careful being in the sun, just in case I do start to become photosensitive. Also, some of the medications I take can cause photosensitivity, so I always have to make sure that if I'm going to be outside for a long length of time, I have to wear a hat, I have to wear sunscreen, sunglasses. I just have to protect myself and try to stay in the shade and try not to be outside for long like periods of time. So that's kind of annoying because I like being outdoors in the summer especially. But thankfully, like I said, I haven't had it where I get reactions. I know sometimes I might feel a little bit more fatigued after being in the sun, which is another kind of sensitivity. I do know that I get a sensitivity to those energy saving light bulbs. I can't for the life of me think of like the correct term for them. But they actually have UV light in them. Those compact fluorescent light bulbs, fluorescent lighting. Fluorescent lighting is not my friend. And I know some people have it even worse. I've known of some people that have actually had to have their work change out the lights or put like a protective screening on the lights. They will have to wear sunscreen if they're in an office that they're under fluorescent lights all day. They will have to wear sunscreen. They have to cover up. They have to wear a hat indoors. Otherwise, they will go into a really bad flare. They will have rashes. They will get very sick. For me, the fluorescent lighting causes eye strain, and it causes me to have really bad headaches. So we have changed all of our lights in our home to LED lights, and it's made a huge difference. But thankfully, like, I don't have it as severe as other people. Another symptom can be seizures, mouth sores or nose sores, and pale or purple fingers or toes from cold or stress, which is Raynaud's phenomenon. And I get that, and I am on a medication for it, which I don't know if it really does much, to be honest. Yeah, my toes get really, really bad in the cold, and I always basically have to wear socks like all the time, sometimes even in the summer, because if I go into like an air-conditioned place, boom, my toes will go numb. It's almost like you feel like you're starting to get frostbite. So, and actually for some people, Raynaud's phenomenon can get so bad that they actually can get ulcers on their fingers or their toes, and some people have even lost their fingers and toes from it because it gets so bad that it's like they have frostbite essentially, and they get gangrene and they have to get their fingers or toes amputated. So I really try to keep warm as best as I can, which poor Alex has to deal with having the heater on a lot of the time when he's boiling and I'm freezing. So yeah, now the diagnostic criteria for lupus is basically a list of 11 common criteria. In order for a diagnosis to be made, you have to have at least 4 of the criteria on the list, either at the present time or sometime in the past. It then gives you it means it's like a strong chance that you have lupus. So of course the first one is the butterfly rash that I talked about. The other one is discoid rash, which is red, raised, and disc-shaped patches. The third criteria is the photosensitivity that I talked about, reaction to the sun or light that causes skin rashes. Number 4 is oral ulcers, and I get those on my tongue. I don't know if I have any right now. I haven't looked in the mirror, but they'll be like these little white circles on my tongue. Thankfully mine don't hurt. I know for some people they can be painful, but thankfully for me they don't hurt. They just look really gross. Number 5 is the arthritis, joint pain and swelling of 2 or more joints, and that is one of the main issues that I suffer from lupus is the joint pain. Thankfully the combination of meds that I'm on right now controls it quite well, but I still get breakthrough pain from time to time, but right now it's pretty well maintained. But before I was diagnosed, I was to the point that my hand, my fingers were so badly swollen and painful that I could not straighten them and I could not close them. So my hands were kind of like permanently stuck in this position. I couldn't bend my wrists. Trying to lift my arms above my head was extremely painful. So dressing myself was very difficult. Alex would usually have to get my socks and my shoes on. He would have to help me get on and off the toilet because my knees were so swollen, getting up and down and stuff. Same as on the couch. Like if I sat down on the couch, he'd have to get help to get me up. It got to the point where I thought I was going to end up in a wheelchair. Like it was that bad. And I went through that for a full year before they figured out what it was. Number 6 is serositis, which can either be the pleurisy that I talked about, which is inflammation of the lining around the lungs, or you can get inflammation of the lining around the heart, which is pericarditis. And I have had pericarditis, I think it was in the summer of 2013. It was shortly after I came back from my trip with my mom, and I was fine all morning at work, and about a half hour before I was to go home, I started getting chest pains. And at first I thought it was just like, because sometimes I get chest pains from my heart issue. And I was like, maybe it's just, the usual stuff. But it started to continue, and it started to get to the point where every time I would breathe out, I think it would hurt. And if I bent over or laid down, it got worse. So we ended up going to the ER, and they did a whole bunch of tests and scans and found out that I had pericarditis. And they put me on high-dose prednisone and an anti-inflammatory for a week, and it cleared right up. So I was lucky that we caught it early, but So there's that. And number 7 can be kidney disorders, which is persistent protein or cellular casts in the urine, which I also had at the time of being diagnosed. They found a lot of blood in my urine, and I had to see a kidney specialist for a while. And thankfully, again, they caught it early enough that it did not do any permanent damage to my kidneys. And knock on wood, my kidneys have been fine since then. So whatever treatment they put me on for that right away, which was my Fortic, it helped. It cleared it up. But we always monitor everything. You know, every time I go to see the doctor, we do urine tests and all that stuff to check my kidneys. Number 8 is neurological disorders, which is seizures or psychosis, which thankfully I haven't had any of that. Number 9 is blood disorder, which can be anemia, leukopenia, lymphopenia, or I'm not even going to try to say that one. It basically means low platelet counts. And for me, I did have a little bit of anemia at the beginning of my diagnosis as well. And number 10 is the anti-DNA. If you get a positive anti-DNA or anti-SM or a positive antiphospholipid antibody in your blood work, that can be a determining factor. And number 11 is an abnormal antinuclear antibody, which is called the ANA. But if you have a really good rheumatologist that knows lupus well, they will know that the ANA does not determine whether or not you have lupus, because some people that have lupus have negative ANAs, or sometimes it can come and go. Like sometimes you might have a positive ANA and other times it might be negative. So it doesn't really determine anything. So basically, like I said, you have to have 4 or more of those things from that list of criteria, whether it be presently or in your past. And so the doctor kind of looks, when they're trying to diagnose you, they look at your history as well as your present symptoms. And if you fit 4 or more of the criteria, they will generally diagnose you as having lupus. So like I said, even if you don't have a positive ANA, but you have 4 other traits on the criteria, they will usually make a diagnosis. So like when I was originally diagnosed, they looked at my history because in 2002, I had a whole bunch of medical things that happened in that year. I was diagnosed with the hypothyroidism. I was diagnosed with the irregular heartbeat. I swelled all over my body. I had pain. I had acid reflux that was completely unexplained. It was not linked to anything at all. And it was constant, like whether I ate or not, like it was there all the time. And I had to be put on medication for that. I had chronic hives from my head to my toe. I actually looked like I had been scalded. That's how bad these hives were. And they were 24/7. They did not go away for like a whole year. And I had allergy testing. I had all kinds of testing, and they could not figure out what was causing these hives. They were just chronic hives, and they couldn't figure out what was causing them. So when I was diagnosed years later, they looked back at all of that and they thought, okay, these weird hives, that's like a rash that you can see in lupus. And then they looked at, you know, I had the kidney issue, I had the anemia, I had the joint pain at the time. So they put it all together, and that's how they came up with the diagnosis of lupus. So as you can see, there's an array of symptoms, and there's just an endless amount of things that can, like ways that it can affect people. So like I said, I've talked a little bit about how it affects me or has affected me in the past, being, you know, the hives, the kidney issues, the anemia, my joint pain, ulcers in the mouth, you know, things like that. But of course also, you know, the fatigue is a big one. So right now it's mainly just managing the issues with my joints and my fatigue. And one of the major things that can trigger a lupus flare is stress. So I really have to try and keep my stress down, and I also have to try not to overdo it. And I still struggle with that because I always used to be go, 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 and I still want to be go, go, go. And sometimes I have to just say to myself, slow down. Because if I don't, then I could end up really sick. Another way that lupus has affected me, because as I said, it can attack anywhere in the body, is it attacked my GI tract. And so I had colitis for a while because of lupus attacking my GI system. And so I had to be on medication for that for a while, and it went into remission, that part anyway. So, but I think it might be starting to flare up again. It's been a couple of years since I've been on treatment for it, and the doctor had told me at some point it probably would flare up again, but he just didn't know when. But I'm kind of getting the same symptoms, one of them being like nausea, which is not fun. But I'll see. I'll be talking to my doctor about it the next time I see him at the lupus clinic, which is near the end of this month. So that's another thing that affected me. And also lupus brain fog is another issue with a lot of lupus patients. And they don't know if it's because the lupus is attacking the brain or if it's mainly to do with the fatigue and sleep disturbances. Because a lot of patients, you know, if they're in pain at night, it causes sleep disturbances. Because I went undiagnosed for a year and I was in so much pain, it really disturbed my sleep. And I did not get good sleep for that whole year. And my body got used to continuously waking up and going back to sleep and waking up and going back to sleep, that even the nights now that I don't feel pain, I still can't get a good sleep because my body just got into this horrible pattern. And so for a lot of lupus patients, it's like that, where we'll be fatigued all day, but then we can't sleep at night. And so they think like the lupus fog could be a combination of just not enough like proper sleep from disturbances and then the fatigue. And it could also be a little bit of the lupus attacking the brain. So for me, my memory is really bad these days. I have to write down everything or else I forget stuff. And also like sometimes you can't get your words out right. Like you have an idea in your head of what you want to say, and then when you try to say it, you struggle to get it out, or you struggle to remember how to say certain words, or it just doesn't come out the way you want it to. So that is lupus fog. And I think I've pretty much covered how it has affected me and how it continues to affect me. And like I said, it's different for everyone. So everyone will have different symptoms at different times. And, you know, for some people, it can attack their central nervous system. So their brains can be affected, their kidneys or livers or hearts or lungs, like anything can be affected. I do have mild asthma that's developed since I have lupus. Again, they can't really say that it's lupus that caused it, but it's just interesting. It just seems like for lupus patients, you don't just get lupus, you get a bunch of other things. Another one that a lot of patients get is Sjogren syndrome, which is dry eyes, dry nose, dry mouth, dry skin. And they haven't officially diagnosed me as having it, but I think I do. My mouth is dry a lot. My eyes get very dry. I know my eye doctor has told me my eyes are dry. So I have to use artificial tears. My skin gets very dry and itchy. So I personally think I have it, but they haven't officially diagnosed me as having Sjogren syndrome, but it seems to be another common syndrome that goes hand in hand with lupus. But anyways, guys, I hope that gave you a little bit more insight as to the different symptoms, the way it's diagnosed, and just the ways that it affects me. But of course, that's just me. That doesn't mean that every patient is going to be affected the same way. Some people have it very mild, some people get it very severe. I could have it mild 1 minute, and then next day I could all of a sudden have a seizure or a stroke or a heart attack. I mean, there's a greater risk of strokes and heart attacks with people that have lupus. That's another issue. So, I mean, there's just so many things because it can attack anything in the body at any given time, and you never know what or when things will change. So you could be doing good, and then the next day you could be in the hospital. You just don't know. So I guess, you know, the one positive of lupus is that you just kind of learn to enjoy each day that you have. You learn how to slow down, and you kind of learn what really matters in life, where it's like, you know, you feel good, you know, take advantage of it, but again, you can't overdo it because you could get really sick. So it's like finding a happy medium, but you definitely learn to appreciate life a lot more, and that every single day is that you're still alive is a blessing, and try and make the most out of it the best you can, depending on how you feel. So, all right, guys, well, I hope you found this video a little bit more informative. And thanks so much for watching. Keep the lupus awareness going. I will put my email again in the description below. So if you guys want to email me any pictures of you wearing, I forgot to mention you can wear purple and or butterflies. And you can send me your pictures and signs that you make or whatever you want to do for Lupus Awareness Month, and you can send me those pictures, and I will be making a video of everyone in this wonderful community. All right, thanks so much, guys. I hope you have an awesome week, and we'll see you in the next video. Bye.